Hello, I am Dr. Ranjani Muthu, consultant nephrologist practicing at Capstone Clinic. Today, through this video, I would like to talk on urinary tract infection. Summer is a very apt time to talk about this because people are very prone for it. So, let us discuss about this topic through 5 question and answers. So, here we go. What is urinary tract infection? Urinary tract infection infection could be because of bacterial, fungal or a viral infection involving the tract of the urinary system, starting from the kidney to the urinary tubes, involving the bladder or into the urethra. So it can be divided as upper tract and a lower tract according to the site of involvement. So second question, why do I worry about urinary infection? So when according as we already told about the lower tract and the upper tract, when the lower tract is involved and the patient has got just some urinary symptoms, he can just get away with mild infection. But if repeated infection occurs, it can go and affect the upper tract also. So when this upper tract gets involved, especially the kidney and the urinary tubes are involved, with repeated infection, there could be a possibility that patient can go for renal dysfunction and there can be an increased risk of acute kidney injury temporarily, but later on with repeated episodes, patient can have an increased risk of chronic kidney disease leading on to renal failure. So we should be very much wary about urinary tract infection and cannot be taken as lightly. So the third question, what are the various risk factors and symptoms associated with urinary tract infection? So mainly the important risk factors are the elderly age, being dehydrated, and history of stone disease, because it could be a foreign body because of which the patient can be at risk of urinary tract infection, or there could be a structural abnormality in the kidney innately making the person prone for urinary tract infection. There could be some specific diseases of the kidney, especially like autosomal dominant polycystic kidney disease, where the cyst is there involving the whole of the kidney, and they are more prone for urinary tract infection. And sometimes instrumentation into the tract makes them prone for urinary tract infection. So these are some of the important risk factors. What are the symptoms? So based on the tract involved, either it's a lower tract or upper tract, we can have symptoms. So when the lower tract is involved, especially the patient can have burning sensation, they can have sometimes blood in the urine, sometimes there can be increased frequency of passing urine, and also there could be a feeling that we have not passed it well, and the passage is not full and they feel like passing again. And sometimes the flow is not good, the speed is not there, and sometimes decreased output is also considered as one of the important symptoms. And when the upper tract is involved, especially the kidneys, so patient will have more systemic symptoms, like they can have fever, vomiting, backache, and most of them will need admission when the upper tract is involved. So next, going to the next question, which is what do I do if I am diagnosed with urinary tract infection? So first and foremost, if you are having any of the symptoms already mentioned, and if you have been possibly having urinary tract symptoms, first is avoid dehydration. Get on to taking lot of liquids. Avoid constipation, and you can take a dolo if you have temperature. Don't self-treat other than taking paracetamol, and please give your urine sample and urine culture before you take the first dose of antibiotic, and reach your physician or a nephrologist at the earliest. Last question, what do I do and to prevent further episodes of urinary tract infection? This is one of the important questions which people should know. It's always good, prevention is always better than cure. So we should avoid dehydration, avoid constipation, always flush before using the private public toilets, always urinate after having sexual activity, and avoid applying local douche or chemicals in the local genital areas. Always maintain hygiene, especially females during their menstrual cycles, and these are some of the important methods with which we can keep urinary tract infection at bay. Thank you.